Good afternoon. This is Dr. Harry Chen speaking to you on a wonderful late fall day from Burlington, Vermont, and I want to welcome all of our UVM families to this Health and Wellbeing at UVM webinar. I'm going to let my colleagues introduce themselves at this point. I'm Dr. Harry Chen. I'm the Executive Director of the Center for Health and Wellbeing, which encompasses both student health, counseling and psychiatric services, and Living Well, which we'll be discussing here today.
Hi, my name is Michelle Pavlova. I'm the Medical Director of Student Health Services.
Hi, everyone. My name is John Paul Grogan. I'm licensed as a mental health counselor, and I currently provide leadership for both our counseling and psychiatry service and our health education and outreach service.
So moving on to what are today's goals. I want to make it clear what we're hoping to accomplish today, and you'll see that on your screen, which is to review the services to support health and well-being on campus that are available to your students, to review health concerns that may appear, particularly at this time of the semester, to offer conversations topics for you to share with your students that will help our shared goal of better health and well-being for all UVM students, and to answer audience questions about student health on campus. So briefly about the Center for Health and Wellbeing. What we offer? We offer non-judgmental, collaborative, student-centered care, a comprehensive and holistic approach to mental and physical health needs of the UVM population. We provide support to students in the areas of medicine, counseling, psychiatry, nutrition, athletic medicine, community outreach, advocacy, and educational programming. And we have a deep commitment to providing students with respectful and confidential health care. Our core services are student health services, and we'll hear more about all of these today. Counseling and psychiatry services known as CAPS. Living Well, our education and outreach arm. So we offer this range of services together to provide nearly comprehensive care for most students right here on campus. And if we don't have access to what your students need, we can refer to specialists in the area.
We are located in many places on campus. You'll see the athletic medicine and sports psychologist is on the athletic campus. CAPS is in two places. They're in a residential complex on Redstone campus and another location just on the corner of Main Street and South Williams. The Student Health Services Clinic is located just across the green in a building that UVM Medical Center occupies as well. And in that building, there is also a UVM Medical Center pharmacy that's really convenient for the students to use. Also, you'll see prominent at the top of this map is actually the University of Vermont Medical Center Hospital, where there's a whole host of services available.
I think it's important to point out who are our staff, and you can see this list in front of you. And it's a wide-ranging list, and I'd actually add one more person to that list would be a dietitian. These are staff who serve the students. They're all trained, licensed, and/or credentialed in their area of practice. Some staff have been here for years, working with college students and the population, and others are new. So we have a constant mix of those who know the population well and those who know what's going on outside in the community. Because we work solely with the college-age population, our staff really interact well with students, and students feel comfortable getting help here and come back when they need to. One thing to note is that the University of Vermont, as a teaching institution, will have graduate-level trainees, whether it be in counseling or social work or even medicine, They are heavily supervised by our licensed staff, and students can always opt out if they're uncomfortable working with a trainee.
So Student Health Services functions much like any primary care office. We are skilled at managing chronic and acute health conditions. When students start at UVM, they are assigned a primary campus provider with the hopes that this will facilitate an ongoing relationship for their entire time here at UVM with a medical clinician. We manage acute illnesses that come up, like infections, colds, flu. We can deal with injuries, sprains, wounds, concussions. Often we're managing diabetes and asthma. And we're very adept at managing mental health conditions like depression, anxiety, and sleep disorders. We do a lot of preventative care with screening for sexually transmitted infections and routine health exams. We provide lots of vaccinations. We also provide gender affirming services with hormone replacement therapy. And we have a nutritionist that works in our clinic as well. So we are open from 8 to 4:30, Monday through Friday, and Saturdays we're open from 9 to 1. We do request that students call and schedule an appointment, just like many primary care offices. But because we're on a college campus and we know that illnesses come up quickly, injuries come up quickly, at the start of every weekday, we have between 40 and 60 appointments with a medical provider open and available for use for acute issues. So if something comes up, students can call that same day and typically get in to see somebody. We also have a team of advice nurses who talk to students and many students every day and give advice on how to take care of themselves and their symptoms. Last year, we saw 5,000, over like 5,800 students for acute issues, and our nurses talked to over 2,500 students on the phone and gave them help that way. After hours, we do use a triage phone system called PhoneMed, and the students can call and get advice from a triage nurse 24/7, well, when we're closed. If your student needs to go to the hospital is really conveniently located to Central Campus. If they're in our clinic and need to go to the hospital, we arrange for transportation, either with an ambulance or a taxi service. The UVM Medical Center Emergency Room is a level 1 trauma center, and the providers there are very skilled. And there's a whole host of specialty practices in the area as well. So if a student's been seeing a primary campus provider and needs some specialty care, we can facilitate referral to a specialist in that area. We also have a travel clinic. So if your student's studying abroad, they can come in and talk to one of our travel nurses about their specific destination and get information, education about what the health risks are for the location there they're going, and get vaccinations and any kind of prophylactic medications for malaria or altitude sickness or traveler's diarrhea, things like that. We also have an allergy clinic where we can continue desensitization treatments for allergies. And I think that's the scope of what we do.
Okay. So I'll talk a little bit about our counseling and psychiatry service on campus. As Michelle noted when we were looking at the map, we have 2 clinics on campus. We offer the same service at both of those clinics. Really, we're spread out to increase student access. And one of our locations is right in Central Campus. One is in a residence hall on the Redstone campus, which puts us in close proximity to an area where a lot of undergraduate students are housed. I think it's helpful to talk a little bit about the work and how it's structured. We're primarily set up much like other college campus counseling services, where we're most adept at providing what we would describe as a as a brief counseling service, meaning that our primary service looks a little different than what someone might expect if they were seeing a therapist in their private practice getting consistent weekly psychotherapy. What we found is that that's a model that can be challenging with a student schedule, and that we see such a demand really in student use of our service that those are two factors that impact how we structure our model. And so what we really try to offer is a flexible service that really trying to meet students where they are and stretching at times of need during this semester. Really, in thinking about our core services, as I said, most of the work that we do is counseling. We have about 20 staff trained as counselors in all disciplines, from social workers, psychologists, master's level providers. We also, at any given time, have between 5 and 7 graduate level counseling trainees that are also seeing students about 20 hours a week. We also have 3 psychiatric providers that are seeing students for psychiatric medical evaluations and ongoing medication management. A couple of things that are new this semester, really in an effort to drop some of those barriers to accessing our service, we've placed counselors in multiple locations on campus, and those include our athletic facilities, 2 identity centers, one for our Mosaic Center for Students of Color and our PRISM Center for LGBTQIA identified students. And we also have drop-in services available in our Student Center right in the middle of campus most days of the week. On top of those individual services, we're strong promoters of group counseling. We know that it works. We get good feedback from students about it, and it allows us to offer a service and an opportunity for students to not only learn from our trained clinicians, but get the benefit of what their peers have to say about some of these same challenges. And I always mention the kind of these things run the gamut from a group for students in recovery from substance use disorders to groups around grief and loss, groups around treating anxiety and depression, groups around adjustment to the university, skills-driven groups about really just developing coping skills, managing stress, anxiety, things of that nature. There were questions about the psychiatric services that we offer. It's important to note that all of the services for the Center for Health and Wellbeing are covered by that student health fee that most families do pay for their students. One exception to that is our psychiatry service. That's an a la carte service or a fee for service that we offer that is above and beyond that student health fee. And so wanted to be clear that folks were aware that service does work a little bit different. There was a question about referrals. We see students for psychiatric medication management both in our student health center and in our psychiatry clinic. Students that are interested in that service are always they're scheduled for a pre-screening appointment where we have a brief conversation with them to direct them to the right service. I'm going to switch to, another slide there. A couple of things that we always like parents to know. Around after hours, we primarily keep our clinic open during the daytime hours, around 8 a.m. to 5 p.m. A lot of the groups that I've mentioned, we run in the evening hours from 5 to 7. Parents often ask about what sort of mental health supports are available after hours. And in order to be very available to students in this way, we contract with an external service that provides after-hour support by licensed mental health providers to college campuses. So this is accessed by calling our main telephone line, and anytime that our office is closed for the day, so after 5 or anytime on the weekend, students are given voice prompts that will direct them to that on-call counselor. I think those are, I'm going to pass to that next. Questions that come up and have come up often in the webinar in advance are, why are students coming to CAPS? By far and away, the most common presentations are anxiety and depression. I would say leaning towards anxiety. being the most common presentation. The rest of the things that you're seeing on the slide are in no particular order, but are amongst the most common reasons that we do see students in. Really, those tend to vary on where they are in their experience at UVM and what may be going on for them. So, as one might imagine, at the start of the academic year, we're seeing lots of those developmental adjustment related concerns, challenges with how students might adapt socially, figure out how to navigate different services on campus, manage being away from families for the first time, and things of that nature.
We definitely find we address a lot of those same issues at Student Health Services too.
Very, very common in that adjustment phase to the university. I'm going to switch gears a little bit and round out our service, and we'll come back to a number of these pieces in the questions, but I do want to make sure that I spend a little bit of time talking about our education and outreach service. We named that service Living Well, and that is a space that is located in the student center, and really we think of these things as our proactive and prevention efforts to address some both health and mental health concerns on campus. And the way that looks on a weekly basis is a robust schedule of programming that includes workshops, exercise classes, series related to mindfulness and yoga, educational series around bystander intervention, increasing student resiliency, managing anxiety, a whole host of things that we know students need support around in their adjustment academically. I always like to plug that we do have a relaxation room with a massage chair that's regularly used. We bring in a massage therapist on a weekly basis to offer complimentary massages to students, and fun things like therapy dogs that come once a week, which is one of our more popular offerings on Friday afternoons. And I would say another portion of the work that we do really is advocacy. So how do we support students in navigating other systems on campus that may be impacting their health and their experience as students? Jen?
So I think an important question to answer is, what else are we doing to improve student health on campus? And I think we want to take a broad view of what health means. And it's mental health, it's staying substance-free, it's physical health. And so all of those things are, I think, to some extent, relate to having students who are engaged, students who are participating with their peers. And so, as an example, keeping students active can really be important for transitioning to a new environment like college. So join a club, check out Campus Rec. We have a website called UVM Board, which tells all the things that are going on, engaging in the programs JP just mentioned and Living Well, and or before, including things like talking to counselors and working with peers. So some of our other efforts include screening and assessment. We use screening tools every time a student comes to student health to try to identify students with concerns over mood, anxiety, sleep, or substance misuse. These students are flagged and referred to integrated behavioral health providers. There are online resources for both self-screening for sexually transmitted infections and mental health concerns. We are participating with the JED Foundation in a 4-year campus-wide comprehensive review of systems to address mental health, substance use, and suicide prevention. This works across the campus, and it involves students, staff, faculty from all departments. The goals of this JED campus initiative are means restriction, marketing and communication, education and outreach, programming, crisis and clinical interventions, and identifying those students at risk, policies and procedures in the institution, and assessment. We find that peer-peer initiatives are extremely successful related to both the individuals who are providing that instruction and also the recipients. So we have 35 plus students that are engaged in peer-peer education, including mindfulness, stress management, bystander intervention, body image concerns, and general health and well-being. Importantly, our efforts have to be guided by data. So we'll administer a healthy mind survey in November, which will give us an idea how we're doing and areas we need to focus more of our efforts. It's a comprehensive national survey to assist us in guiding our work. Access to counseling services, we've expanded, as you've heard, where you could access those clinical services to athletics, our identity centers, and even the student center, the Davis Center, with a different model of drop-in, let's talk appointments as opposed to scheduled appointments. We're also communicating across the campus because student health as our most valuable kind of resource is really everyone's responsibility. And we have to include faculty, staff, academic units, deans in what we're doing for students.
Before I move on to the next slide, I'll respond to a parent question that came in that it feels relevant to the slide we're on. But there was a question about a recent death that we had on campus and how we responded in a way that supported students. And to speak to that, unfortunately, tragedies happen on college campuses, and really it becomes an all hands on deck, sort of response. And the particular question was about what are we doing around mental health in that regard? And what I would say is when something like that happens, we expand our service, and that looks, in this particular instance, that looked like targeted outreach to any of the particular groups that would be impacted. And so that meant athletic teams, clubs, and organizations going into classrooms, visiting with students and talking with students and staff in their residence halls. It also meant expanding our counseling center hours outside of our normal schedule so that we could see more students that were impacted. And so I appreciate that question, and want to let folks know that we are very intentional about how we expand our service and do really targeted outreach when needs arise on campus. Delay there.
Here are some of the things that we tell students, and we hope you will too. It is completely normal to experience bumps with both the transition to UVM and at times throughout college and young adulthood. We ask them to take good care of their body, exercise, eat well, don't use substances, make connections. Make an effort to build a good community. Find support here at UVM. Reach out and talk to people in your classes. And use our services. There's a whole host of people here that are highly skilled and trained to help the students out.
I'll share this slide as a framework. We were fortunate as a campus to have Corey Keyes, who's a positive psychologist and researcher, with us to educate us about 1.5 years ago. And he has done some really great research around what flourishing looks like on campus. And I know this may have been shared previously, but this is something that I use clinically, and we really think about it as an opportunity to frame our work. And what Corey Keyes' model showed us is that these are really the dimensions that really support a student or really anyone flourishing. And our goal is not just an absence of mental health, but what we're really looking for is flourishing. And I like this model because it's clear and straightforward. The size of your bubbles indicate how you might balance your time. So you see education and interacting with others and playing are some of those bigger blocks. And so these are the sorts of things that we're saying with students, and we think these are things that we would want and remind you to also be having conversations with your students.
Our asks of you. Be our partner in this work of supporting your students to be healthy.
we really want to encourage parents to be curious about what's going on in your student's life on campus. So what are they involved in? What decisions are they making? And I think that can be even a little more granular. Are they getting enough sleep? How are they navigating services on campus? What is their substance use like if they're choosing to use substances, and how might that impact sleep and mental health and exercise and social components? Really we're asking students these questions when we see them medically and in counseling settings, and we think they're important for you to be engaging around as well.
And then finally, to be aware of the plethora of resources that are available on campus that support student well-being. So, for example, I think many of you are really kind of interested, curious, and perhaps even a little anxious about how how can you find out about your student in terms of how they're doing. We have a system called care forms, which could be submitted anonymously, where a student, a faculty member, a staff, a friend, or even a parent can submit these forms if they actually have a concern about an individual student. And there's a process by which we can evaluate them in a collaborative, multidisciplinary fashion to really decide if we need to reach out to that student. Oftentimes it's in a dorm, and so residential life can provide that kind of touch point to make sure that your students are okay. The dean's office and the vice provost are always available and welcoming your call if that's something that you feel like you need to do. We have online mental health screening tools. There is a Vermont crisis text line where an individual can text their concerns to a trained counselor. So there's many resources available that can both help your students and help you feel comfortable that that your child is in a good place. So next, we want to kind of be more specific to conversations for this time of the semester, and I want to just start off with Halloween. Halloween is a wonderful holiday, but as many of us know, including you as parents of high schoolers, that it is a risky time to some extent. So it's a high-risk time where students can make high-risk choices. I think I would just really want to let you know that they're actually celebrating it this weekend because Halloween is on a Wednesday, and that this might be a good time to check in with your student to just kind of remind them that it's Halloween and it might be really easy to make some bad choices. I think there are many options available to them this weekend at UVM, and whether it be in school, on the campus or off the campus, and many of those things are listed in Board UVM.
Serious illness does happen. The typical ones we see might be respiratory viruses like the flu, or the Epstein-Barr virus, which causes mono, and that can lead to some prolonged fatigue. We can manage those students in the clinic. If a student needs to be hospitalized, we can facilitate making that happen. One of the ways that we start managing serious illness is with prevention. We require first-year students and transfer students who live in the residential halls to be vaccinated against measles, mumps, rubella, hepatitis B, tetanus, diphtheria, pertussis, and meningitis. And we like to see varicella vaccine or documentation of chickenpox. So that's a great place to start. We offer flu shots. We have had 2 really well-attended clinics at the Davis Center. Every student that comes in through our doors for a visit with either a provider or a nurse gets asked if they want a flu shot. We've given out over 1,000 so far since October 1st when we started administering flu shots. The next Davis Center clinic will be November 7th. And there's also walk-in times Let's see, where do I have those written down? So walk in, you can come walk into the clinic between 8:20 and 10, Monday, Tuesday, Friday. All those times are posted on our website. And encourage them to come to the Davis Center on November 7th and get a flu shot. I guess another question we had was about if the flu shots, what the charge was for them, and we do charge $21. It is covered by insurance. The students just request a receipt and then can submit that claim to the insurance, but the $21 charge is posted to the student account. I think that's all I have for flu shots.
So, and this came up in the questions a little bit, but wanted to speak to, sometimes when things aren't going well for students academically, and that we sort of crossed that midterm mark, and this is often a time where, really in both our mental health clinics and our primary care clinic, we may interact with students that may be struggling academically, and I think what I would want parents to know, or is helpful to know here, is that this is there are ways that the university can support students when they are having a challenge academically due to a medical reason, and we are certainly able to assist students and families with those situations. Really, this is an academic process, and so what the takeaway here is to know that if your student is having trouble or any sort of difficulty related to a medical reason, you really want them to be in touch with their student services office in their academic unit. So whether they're in the College of Arts and Sciences or the College of Agriculture and Life Sciences, those are the places where there are support staff, and those support staff are closely connected with all of our clinical providers in figuring out plans to support students around those things. So that's what I would say about that. This is a stressful time of the year, and I think our weather is changing. We're going from beautiful fall days to shortening days where it's getting dark and cold, and the weeks leading into the end of the academic semester, traveling home for Thanksgiving breaks, the winter break, finals. All of these things are an opportunity to create stress and challenges for your student. And so the things that I want to point out that we do a little bit differently, we, in the final weeks of the semester, we broaden our walk-in offerings in our counseling clinics to make sure that these services are accessible to students in the last week of class and during finals week. We offer expanded really de-stress and relaxation focused programmings in our education and outreach office towards the end of the semester, and really are encouraging students to reach out in a myriad of ways, but feel it's important for parents to know that this is an optimal time to really be checking in with your student around what they may need proactively as we think about what may be the hardest time of the semester for many.
So at this point, we've made our presentation about the kind of background on the services we offer your students. And I think John Paul will start off with answering some of the questions we received while people were registering.
So one of the questions, and I'll just start because it's my area, but asking about our counseling center model, and I was also going to dive a little deeper into how students access appointments and what sort of appointments we specifically offer. And so the answer was, the question is about short-term counseling. What if a student needs long-term counseling? So we work closely and actively with students to really both assess what they need. I think sometimes students think they may need long-term counseling, and actually they're a good fit for our model with, appointments with us and accessing other resources on campus. But certainly we engage with students and community providers around connecting students to those referrals, and continuing to check in with students until they can make those referrals. So there, what's convenient is that we're located very near downtown Burlington, where there is both foot and walking access to a vast number of mental health providers. And so, these are resources that are available when students are looking for something beyond what we offer. I do think it's helpful to talk a little bit to kind of appointment types, because this is a challenge that we run into during this time of year towards the end of the fall semester, post midterms, is just a challenge to manage the demand on our service. And proud to say that 20% of our population use our service. They trust us. They know that we offer a quality service, and it's a positive and a challenge for us to meet that need with that kind of volume. And so what I think it's important for families and parents to know is that, we have mechanisms to see students that have urgent needs, and we hold appointments every day for students that are in emergency type situations, and have the flexibility to stretch around those. What we do see around this time of year is that students may need to wait for periods of time longer than they might like for more routine and non-risky counseling situations. And one of the things that we do to manage that is offer drop-in supports in multiple locations around campus, multiple times of the day, throughout each week. And really it's, for us, it's a resource management. We want to be able to offer those outreaches and to respond to needs on campus, and to be able to see students when they want to be seen. So. We got flu shots. Let's see. How can my student find out what time therapy dogs and chair massages are offered at Living Well? So we post on our website, we post on social media, Facebook and Instagram, but by far and away the best place to know about what's going on is the uvm.edu/board website. And our Living Well office has its own channel around wellness. And so any event that we offer week to week will be advertised there. So folks know therapy dogs are from noon to 1 every Friday, and chair massages this semester are Tuesday from 9 to noon. And there's the opportunity to drop in to use our massage chair anytime our office is open. So that's 8:30 to 5 days a week.
And on that note, I'd actually encourage you to talk to your student about just dropping in to see what's available at Living Well, because it's a really comfortable, welcoming place for students.
Can I just clarify, the board is BORED and not BOARD?
Correct.
And that boredom can sometimes happen when students first transition here and they don't have connections and they're having difficulty adjusting. So that board site is a good resource. Living Well is a great resource. Encouraging students to reach out and just reach out to their classmate. But making connections is a really important part of adjusting to UVM.
And on that note, I will name for our audience that far and away the most popular question we received in advance of the webinar was, my student is struggling to connect socially, to find their people, and I assume these families are speaking about first-year students, but so far and away social concerns was the question most asked. And I think in our clinical settings, that's something that we speak to students about a lot. And I think what I would say to parents and is what I often say to students is that this adjustment is particularly challenging, and particularly in that first semester. And I think we have some cultural myths around this college experience, best 4 years of your life. Everything is fun and exciting. And I think while that's not entirely untrue, I think that that's not true for every student. And what I often want to normalize in my conversations with students over the years is that that first semester, and for a lot of students into that second semester, it takes a lot of time to make that adjustment and to build those social connections. And if I were to simplify it, I really think it's about finding your people, and finding the people that were in some ways similar to the people you had in high school or before you came to college, and whether that's centered around a sport that you play or a hobby or your academic interest, that's often where I encourage students to start first. Anything you would add to that?
I totally agree. We, being college health medical providers, we are well aware of this adjustment period and do address that at our visits when it comes up. So.
Right, and I think, clubs are an incredible resource, and there's probably more clubs than anybody could ever imagine. And so I'd encourage you to go on the website and check out the clubs, because there may be an alignment with what your student likes to do or what their interest might be.
Mm-hmm.
So one question, where's Living Well? Living Well is on the first floor of the Davis Center. So our student center in the main, in the heart of our main campus. Let's see. We're getting additional questions on the cue cards. What if my student's having a hard time or isn't leaving their room? And isn't reaching out. I think that's one of the, as a counselor, and I would say, Michelle, you probably would say similarly as a provider, that's a tough one. I think my first thought is to think about, is there a person that they're willing to reach out to? We have quite a robust residential life staff of both peers in their residence halls, but also professional staff in their halls that every student should know as part of their move-in process and adjustment to campus. Students will meet their RA, they'll meet the professionals in their building. I think that's often a place to start. I think if your student is really unable to do these things, then I think that parents have some tools at their disposal. And Dr. Chen mentioned the care report form, which is really your link to share really specific concerns with our Dean of Students office and our residence life staff that are really the kind of feet on the ground and staff on the ground that are looking out for students and keeping an eye on students. And so, you choosing to fill that form out would notify both our Dean of Students office and our professional residence life staff what your concern is, and that allows us to respond and do some intentional outreach to your student. Because I think my worry is that student, my want is for them to talk to someone, and whether that be a peer or their RA. I think the idea is to find someone that they're willing to talk to. There were some questions about how we talk about and educate around substance use on campus. And I would say that starts before your student even comes to campus. All students take a fairly lengthy educational program that is required around alcohol and cannabis use. And that ideally starts the conversation and provides some education. We provide fairly robust programming and education during that opening weekend that students come to campus. And then there are many opportunities. We have staff in our education outreach office that are dedicated both to doing screening and education around reducing risk around substance use and providing education. Sometimes students come to that in a required way, maybe because they've broken a policy in a residence hall, and so they get referred to those services. I also want to remind parents that we offer a myriad of supports for students that are choosing not to use substances, and that could be voluntary, or that could be because they've struggled with misuse in the past and are intentionally choosing to remain sober. And so always highlight our Catamount Recovery Program, which offers both drop-in and casual social support, as well as things like game and movie nights on weekends that are an offering of substance-free programming, or programming that is specifically for students choosing to not use substances.
We also screen at Student Health for students when they come in the first time, and then every 6 months for substance use. And anybody that is flagged positive or that they might be engaging in some risky behaviors, either the medical providers will talk to them with a brief intervention, or we'll have our integrated behavioral health specialist talk to them, usually right at the same time as the appointment.
There were questions about anxiety, and as I mentioned earlier, really one of the most common presentations that we're seeing in our counseling service. But when you talk to deans' offices and faculty, they're aware of students feeling anxious and presenting in anxious ways. And so, we're approaching that both in a preventative way with educational offerings, whether that, and that really spans from mindfulness, meditation, yoga offerings, teaching students courses on resiliency and making good decisions about how to manage their time. We also are treating this in our clinical setting. So that's in any of our counseling settings, both in individual and group settings. I also think, we see a lot of stress, but stress also becomes anxiety, and we're certainly equipped to treat that medically, both with our psychiatry providers and our medical providers in the Student Health Center. So I think if these are questions, when anxiety is, I always talk with students about the difference between stress and anxiety, and if things are getting in the way of functionality, so not able to study, not able to concentrate, not able to get work done, those are the times that I'd want that student to be having a conversation with a clinical provider, either at counseling or in our student health clinic. And kind of an offshoot of that, oftentimes when students are anxious or struggling with anxiety, sleep's the problem. And there's more and better data out there that sleep is really critical to college student success, and the absence of is going to make a challenging time even worse. And so once again, those are things that if a student is really struggling with sleep, I'd want them to be in connection with our clinical services, either primary care or counseling.
And I also think potentially a good, nice message as a parent is just to remind them how important sleep is, because once you get way far behind, it can actually make things even worse.
Let's see. There's a question about eating healthy. Michelle, are you able to speak to that a little bit?
This is a difficult question. How can I make sure my student eats healthy? It's really hard to answer. Most people's eating habits are established during childhood and early adolescence. And so those habits that you showed your child growing up, that's a great foundation that you gave them already. And now they're here, and there's a lot of healthy options in the dining halls and the surrounding Burlington area. And there's a lot of unhealthy options too. So it's going to be a matter of navigating those choices and really kind of talking to them about how did you feel? How are you feeling about how you're eating, and how's that making you feel? So do they have enough energy to get through the day? Are they eating breakfast? Are they going how long between meals? Things that you could check in with. Are they eating fruits and vegetables and grains and proteins? And that might just be a way to remind them of some of the healthy eating habits that you already got them started with.
I'd also add that in the residence halls and in the dining service, that there are ample options in terms of healthy foods, whether it be healthy foods or whether there are dietary restrictions. They go to great lengths to work with the students to make sure they can get healthy food. And even to some extent, I think we can design eating spaces to encourage healthy choices.
Had a question just come in online about an experience that resulted in either confusion or wasn't a positive experience around an initial consultation. And I'm going to make an assumption that's about an initial consultation in our counseling and psychiatry service. That's the terminology that we use. So Without being able to go into a lot of specifics, my first thought would be to encourage that student to follow up with that provider, whether that's scheduling another appointment, reaching out to them via our secure messaging system that we use for clinical contact with students, to really maybe ask for some clarifying questions or talk about what's going on. I think what I would add to that is, as we all know, we don't always connect with health providers or mental health providers that we meet for the first time. And so if there was some, really drastic miss between your student and the person that they saw, we do not make it difficult at all for students to see a different provider or see another provider. Or, and I think, our front desk staff and our counseling and psychiatry clinic are quite adept at navigating students through that process and how to get them connected with someone different or reconnected. And I think the key here is for that student to reach back out to our service and explain to our staff what happened and maybe a little bit of why at the level they feel comfortable. And I'm confident that our front desk staff can help them, make some decisions around what might be helpful there. And I think to follow up with that, there were some questions about releases and communication and how we're able to communicate and talk with parents. And I think it's just often talked about in orientation, but a helpful reminder that most of our undergraduate students are above the age of 18, making them independent adults and owners of their own confidentiality around their healthcare services. And so that is a fact that we're bound to around our clinical licensure. And so, very simply, without a student's express permission, we can't even confirm or deny that we've had contact with a student. And so that's the very simple line. The reality is that we have contact and conversations with lots of parents because students sign releases and give us permission because they realize that that's helpful or that's an integral part of their care and supporting them. And so, always want to remind parents that we're happy to take information, we're happy to receive information in our areas. Sometimes we're limited in terms of what we can share back with you. And in situations where we need you to be part of that care, know that we are talking with your student about how to involve other people in their circle of support with families. So,
one question I want to touch on is about what urgent care options there are in the area. We of course have the UVM Medical Center emergency room, which is basically adjacent to Central Campus, and then in the and they're 24/7. And then in the surrounding area, we have 3 different urgent cares that are relatively close with evening hours and weekend hours. So there's some urgent care access. And we, during our hours, Monday through Friday, 8 to 4:30, and Saturdays from 9 to 1, do facilitate same-day appointments for urgent needs pretty well.
One, trying to make sure we're hitting all of the questions that have come in. There was a specific question about, who can check in with my students on campus, and I think we covered it, but wanted to come back to, we're as clinical staff, we're very much in our offices and in our centers, and so we're often we're in a place to receive students seeking care. But really, that mechanism of reaching out and eyes on comes through the Dean of Students Office and Residence Life. And so once again, reflecting back to that care form, communicating through the Dean of Students Office and the Office of Residence Life when you're feeling like maybe someone needs to have eyes on your student or check in on your student.
And if your student calls, we got a question about what do you do if your student calls when they're ill? My advice is just to talk to them as if they were there with you and ask them, what are their symptoms? What are they doing to take care of themselves? Maybe give them some advice about resting and drinking fluids and taking acetaminophen or ibuprofen if they're having fevers. Are they drinking? Are they eating enough food? If they sound sick enough to you that if they were right there with you, you would take them to their primary care doctor, then have them call the Student Health Center. Another question we got was about, do students need to have any documentation when they come into the student health center, they just would need their, to know either their 9-5 number or have their student ID handy. If your student has some chronic health conditions, it is nice for us to have medical records related to that condition. Along the way, if something develops, our medical providers will facilitate getting whatever records they feel they need so they can walk students through that process. It is helpful for us to have current insurance information in our records, because when we do labs, when we send labs from our facility to the UVM Medical Center, we will use the information that we have in our system. And so for the billing to be appropriate, and current insurance card information is helpful to have in our system.
So we're coming close to time. As I looked at the questions one more time, and one that sort of jumped out at me and feels like maybe a place to wrap up was, and I think we talked about this a little bit at the start, but the question was, what prompted this webinar? And I mean, I think a number of things prompted this webinar, but really it's our interest, similar to the previous, to create better and open lines of communication with parents and families, and I think to put some faces with the names of the people that are supporting your students, and to provide you with more information and more in-depth information about how our services and systems work. I think we do a good job about having nice and pretty websites, but I think opportunity to talk with parents and families directly and ask questions feels like a way that we can better, I think, work together, because that's ultimately the goal here. And to know that, we offer a lot of things, we expect you to do some things, and want to really highlight that that really is a shared, it's shared work for us. And we say it's shared work with parents, and we say it's shared work with our partners on campus. And so that's really the prompt. And this is new. This is our first webinar really across the table. So we appreciate your patience as we shuffle papers and stumble and stammer around. But we appreciate your participation and the questions, and we're easily locatable on the web and happy and field parent calls and emails and questions all of the time. And so please know that this is not a last opportunity to ask questions of us. So.
Yep. Thank you for joining us.